Good morning. Good morning, everyone. We want to welcome you to this Zoom introduction to guidelines that have been worked on by the Discernment team. We initially called ourselves the Emergency Response Team as we began to find ways by which to give guidance to all of our churches in the Presbytery regarding what was happening in New York City with a pandemic known as the coronavirus. We know that many of you have received information from the governor about possibly regathering. We know also that the president of the United States has made statements about getting back into worship. And this team that is on this call that includes Derek McQueen, Thea Reggio, Samson So, Brenda Berkman, and Mark Koenig and I have been sifting through literally hours and days of documents that we have received to try to give you the best guidance that we can give you for churches in New York City, Presbyterian churches in New York City that are in the midst of this COVID-19 pandemic still, even though it's lowering. Before we begin, we would like to acknowledge both your presence and give you thanks for being on this Zoom meeting. And we also want to acknowledge our God who has been with us in the midst of this time and is still with us. So will you join with me in a word of prayer? Gracious God, this day is the day that you have made. And as much as some days may seem like all the other days before us or days that will follow, this is a day that you have made, and we want to rejoice and be glad in it. Glad that you are with us, glad that we can speak to you and that you can speak to us, glad that we can be together in fellowship among the body of Christ that's represented on this computer screen and by telephone. We give you thanks, O God, that you continue to communicate to us in many ways, and so help us to be attentive to this way by which we are learning from you and learning from one another how to be responsible to worship you, to be together in fellowship, and to serve the people of New York City that surround our houses of worship. Be with us, we pray, in the powerful name of Jesus, who never leaves us or forsakes us and is always willing to be there with us, even in this meeting. For in his name we pray. Amen. Thank you.
Thank you, Bob, for opening us in prayer. It's a good reminder that the work that we've been doing here has not been, it has been under the call of our God and the church, and that we put these things at the fore. This morning, our hope is to provide a summary of our work. Hopefully you have also begun to receive the written guidelines that we have, and we are developing the online presence of those on the Presbytery of New York City website to be available to you. So just to say that this is an overview, and we're excited to have you with us and to have this conversation and to welcome your questions, but it's not your only opportunity. So we want to be clear that this team is ongoingly available both to keep the information updated and to continue to be a resource. And so at the end, we'll be talking about the next meeting that we've organized, and just make sure that you know that we're available to you. So I just don't want anyone to feel like this is the be-all and end-all presentation. We wanted to let you know that we've considered the theological, ethical, social, and science-based considerations that you will want to use in your discernment for your community. These are guidelines. We are forming these as a way of supporting your process, but not as a strict recommendation. The first thing we feel it's important to do is to shift ourselves into a mindset of long-term resiliency. So as Bob mentioned, we started out in emergency mode, in crisis mode, as I'm sure many of you did. And it's now clear that this is a long-term, complex, rolling set of issues. But it's important to remind ourselves that although rollouts have begun to reopen certain types of our society, we are still in a pandemic. And that is an important place for us to sort of settle into and allow ourselves to be there as we discern for our communities, based hopefully on these guidelines and other information, how to move forward. The priorities that we lift up to you are those that align with our calling as a church, with our polity, and with our responsibility to our congregations and communities. So caring for the vulnerable, the mutual responsibility as a presbytery, and congregational care. With regard to caring for the vulnerable, we return to our Matthew 25 presbytery commitment. Matthew 25, of course, tells us who are our priorities, the least of these, those who are most vulnerable. And not surprisingly, these align almost identically to those who are most vulnerable to COVID-19. And so we have used that as a starting point, remembering that all decisions that we make are based on what is best for those who are on the forefront and who are most vulnerable to contracting the disease. Mutual responsibility. It's a reminder that all the properties of the presbytery are joined together through the liability for those properties, and any mishaps, events, lawsuits that occur within any one of the churches escalate up to the presbytery. And so abiding by state law, following up with our insurance companies, making sure that we have abided by the legal and corporate guidelines is a must to protect us all. And of course, congregational care. And congregation also extends to the community, but in the sense of your place of worship and people who are affected by the comings and goings in that place. So considering the health and well-being of all your members of the worshiping community. And obviously this goes beyond Sunday morning, although Sunday morning is one of the things that is most on our minds. So this one summary slide gives you a sense of what the guidelines actually provide in greater detail. So this basically raises the issues, and with each of these issues in the guidelines, we've provided some underlying resources and information for you to consider. The demographics of your congregation, for example. CDC and New York State have agreed that the actual vulnerability to the disease begins with those over 50, while morbidity and the seriousness of the disease escalates over age 65. We're really looking at those over 50 as being quite susceptible. So that's an important demographic when you think about who shows up on a Sunday morning. Also, considering if you have essential workers, those who work in grocery stores and deliveries and healthcare, and others who have ongoing contact with the public or live in situations that make it impossible for them to be completely quarantined from the outside. Transportation, how do people get to your church? Do people have to take public transportation in order to get to you? What considerations are you asking them to encounter in order to come to a worship service? And then do you have the ability to test people who may arrive at your site to maintain a clean and healthy environment according to the standards that have been set by the state? So those two pieces are are quite complex, and we have guidelines around testing and what's possible, what's not possible at this time, ways that different businesses are doing that. And then we've provided links in the guidelines to the state standards that are required, especially for a deep cleaning of a church prior, but also, excuse me, guidelines about maintaining cleanliness and thinking about the facilities that you share, the objects that you share, the surfaces that you share in a common space. And then, of course, considering who is left out. Those who do not feel comfortable coming to church, regardless if you open your doors, those who are not able to do so, and those who you may choose to say, you know, we are not comfortable having those who are vulnerable exposed to people in the healthcare profession, whatever your conversation might be, who's being left out and what accommodations might you make for them. And finally, the huge consideration of how you serve beyond Sunday, how your facilities might typically be used, and how you're considering using them, and what exposures that may have, but also how you may continue to serve both on Sunday and on the other days of the week without necessarily using your building. So being the church, as you all have been in this new time, without relying on those physical spaces. So the guidelines for discernment in shorthand ask you to consider the people, the space itself, the presbytery and your mutual connection among all of yourselves, and then the greater community. If the gathering that you're having has implications for those who are met outside your walls afterward by those who have gathered. And we'll talk about that in the context of some of the upcoming slides. Unfortunately, the reality is that churches are high risk, and super spreading events have been traced to churches. Reopening in other states have led to reignition of chains of virus in other communities. So we are faced with the fact that the things that actually cause this virus to thrive are all present when we gather on a Sunday morning in our traditional ways. So the fact that it's a gathering indoors, the fact that there are multiple people, that there are shared surfaces, shared facilities such as bathroom facilities, cooking facilities, kitchens, and so on. Just the fact that they're speaking and singing, which again we'll talk about a little bit further on, and the fact that this is over an extended time frame, which allows the spread of the virus through the aerosols, what comes out of our breath and goes into the air and is circulated by our air circulation systems and so on. So the key considerations in caring for the vulnerable are assessing those who are over age 50, with a particular risk for those over age 65, and how you will accommodate them, since it is clearly not safe for those folks to be out and about, particularly in these high-risk situations. New information came out last week that those with blood type A are more vulnerable to the serious iterations of this disease. So this basically, we included this partly just to say this is an evolving situation and we don't yet know everything that we need to know about it. We don't know if antibodies have a lasting effect or a temporary effect. We don't know if they have a complete effect or a partial effect. The testing is as yet incomplete. It's an evolving situation. So that's an important thing to recall as well, and that new things are coming. The effect on children is still emerging. The fact that underlying conditions are a factor, and that 70% of Americans take at least one prescription. So more of us have underlying conditions than we realize. If you can write off the age piece because you're sure you're healthy, you know, you don't know the blood types of the people in your congregation, and you certainly don't know what underlying conditions, chronic or managed by medication, might put them at greater risk. And lastly, but certainly not leastly in the context that we're in, people of color, communities of color, are at greater risk. And in these days, it is impossible for us to look away from our responsibility for communities of color and how we care for them and how we keep them safe, how we keep ourselves safe in communities of color. This is a critical piece of our consideration. And then the mutual responsibility piece. So insurance, being up to date on insurance and having contacted your insurance provider to make sure that you're in compliance with whatever they are requiring around cleaning, around testing, around the proportion of people that can be in the space, et cetera. The state guidelines, which as Bob mentioned at the top, are evolving. It's our position that while some of this has been accelerated, that is not particularly in line with the science, but rather is in response to pressures that have been brought to bear. And that there's also a consideration about how and for what purposes people are gathering in groups of 10 to pray in silence, to have a space available for silent prayer at social distance. That's one thing, but this is not a panacea to say 10 people together or 25% of your population. And then also the Presbytery liability that we mentioned earlier. The other thing that we want to commend to you is planning. Sometimes it seems that a crisis has already occurred, and so why plan? But Brenda may speak more about this when we do the Q&A. Planning is critical because this situation not only is an evolving one, but it's not one that happens in isolation. So hurricane season just started. Other types of things may layer onto this, and it's important to be prepared as much as possible. And also to keep a record of what your planning process is. And we've provided outlines for plans in the picture in the guidelines. We've also provided resources from a myriad of sources. As Bob said, we've spent weeks and hours sorting through all this information. Our denomination, Presbyterian Disaster Assistance, which you're all familiar with, I'm sure, has long-term planning materials available on the website. So your congregation can avail themselves of planning materials, of webinars, and other resources through the denomination there. NIDIS, the New York Disaster Interfaith Services, with which the Presbytery is affiliated and you're represented on the board, is one of the local organizations providing planning webinars and training around what they call the continued operations planning. And you can sign up for these. As you can see, there's a calendar, and we have included NIDIS's information in the guidelines. There are also church-specific resources included in the guidelines. One that we commend to you here is provided by the Humanitarian Disaster Institute. It's a full manual on preparing your church, and it takes into consideration many of the things that we have considered. But just remember, we are in New York, and some of the latitude that's offered may not apply in our area. We've also provided governmental and national and international agency references for you, including this decision tree, which is very helpful. It's an algorithm that sorts through the yeses and nos. Do you have this? If yes, do this. If no, do that. So we commend this one to you in particular. There are also many scientific reports. I just want to touch briefly again on the aerosol spread, which is a huge consideration. Speaking and talking, even with masks, does aerosolize. It means turns little clouds of vapor coming out of your mouth, and it accumulates over time. And this is why we have these super spreading events when people are in proximity to one another indoors for a period of time. The National Association of Teachers of Singing has created this 2.5-hour webinar. It's very detailed and helpful with regard to church singing, which is of course a huge consideration for all of us. No, not everyone may want to spend 2.5 hours, but just to say folks have kind of put a lot of time into this consideration, and it may be useful to look at that. Also, we have resources that are less detailed that you may want to look into. Also speaking about singing, but it applies to loud talking as well, projected talking, which is of course something that we traditionally would do in a church service. So that's basically a top line summary. We want to open it for questions and discussion as quickly as possible. And as I said, you'll be getting the full guidelines, and these will also be posted on our Presbytery website, NewYorkCityPresbytery.org, and being updated throughout the pandemic. So thank you for listening to this summary, and I'm going to stop sharing my screen so that we can begin to respond to questions that may be coming in the chat.
And there are questions coming in the chat. We'll just kind of run them down in order. Sorry, I hid my, but you can see the top of my head anyhow, so I can read. If members of the church, deacons and elders engage in a visit, as a result of this activity, someone gets sick with COVID-19, can the church be sued?
Probably yes. Probably yes. You know, as some of you may know, the Presbytery encounters lawsuits for any number of activities that occur in churches. So it's not to say that's de facto going to happen, but the possibility is there, yes.
Question, will the slides be available? The webinar is being recorded. I can answer that piece. Thea, will the slides be available separately?
Sure, we'll put them up on the website, and if there's an email list, we can send them out that way too. Sure.
One of the considerations listed was testing. Are you asking churches to consider the available testing for its congregants? Are you asking churches to consider other measures such as taking temperatures like other establishments do? Right.
So in the rollout guidelines, in both the state guidelines and the CDC guidelines, you will find that that is a recommendation to have the ability to do testing. So for example, I'm sure all of you have seen businesses that are doing temperature checks. The concern that we have about even complying with that is that the tests right now are not that reliable. So even the good tests have a high rate of false negatives. But more to the point for us is you're only seeing folks once a week. So because this virus is spreadable while people have no symptoms, they may develop that temperature the next day. You may not know about it in the intervening week. So it's a particularly difficult one for churches to figure out. Not to say it's impossible, but just that it's complex. Everything seems just a little bit more complex for churches than other things, which is why it's not apples to apples for just opening up in a straightforward way in these early phases.
Are the resources that we cited attached to the document that was sent out last week? I responded to that privately saying they're not attachments, but they're there as links. And that's correct. Is that the correct answer, Thea?
That's correct. That's correct. Because, and the reason we provided them as links is it's such a fast moving train. We want you to have the fresh link. For example, from 2 weeks ago to last week, it changed to being this 25% of your congregation number for phase 2. So we want you to know what those considerations are.
Have the state guidelines been forwarded to the churches? Again, I think the answer is yes, but they are evolving. They continue to evolve. So I think if you go to the website where we've linked to the state guidelines, they should be updated. So you may need to check that on a regular basis. Our church rents to other nonprofits. What if these entities can open given the constructs of their populations and missions before other ones and before Presbytery or our insurance company rules it is safe for the building as a church to be opened? How do we negotiate that? And then a very similar question, AA wants to resume in-person meetings in our space. What do we require for that to happen?
So the guidelines should give you a good sense of things that hit all of the points that we mentioned. So the number of people, for example, currently 10 people, that means 10 people in the entire building, whether you are a church with multi-stories or whether you're a small church. And if you're a small church, those 10 people would need to be able to be positioned at least 6 feet apart from one another. So you would need, I would say the thing to do would be to have very detailed in writing commitments from any group that you would have in the church that meet the standards that you and your session set based on these guidelines, wearing masks, etc.
Are these links easy to find on the website? Bob, that's probably a question for you. And
Are these links easy to find on the website that are in the document?
correct.
They should be, but like all links are specifically dated, and if they've been updated, they may not always be in the same format, but we will try to make sure that what we put on the website is updated information. So if you go to that link, you should be able to find it on the website.
And please let us know if you find broken links, and we'll work to update them, because what Bob is saying, you know, sometimes that changes, just the code, the information is still there, but the code changes. So please let us know and we'll keep it updated.
If a member of our church goes to an activity of prayer out of the church building and wrongfully says that he or she is representing our church, is the church liable if he or she gets contaminated or contaminates someone else?
Unlikely. That, I mean, especially an outdoor meetings, but if the meeting is taking place in another space, the fact that they're representing your church is would not be a relevant factor in the tracing.
We decided at our task force meeting, this kind of relates to tracing. We decided at our task force meeting last night to use the daily attestation forms for everyone coming into the building on a daily basis, staff, constructions, and rentals. Are other churches doing that or being advised to?
So it's very sound advice. Obviously, we have a range of churches, from churches that have no pastoral staff or no staff to support such an activity. So this is why we're providing the considerations and the resources as opposed to making specific recommendations. I think that's, you know, that kind of thing is exactly what we're asking churches to do, is to form a task force, do your planning, use the guidelines to the extent that they're helpful, and implement plans like that as they're feasible.
Okay, let's see. So Jonathan from the trustees suggests, in my opinion, protocols for third parties, that would be groups using the building, should be in place prior to opening. Also, indemnity from the third parties should be sought. Jonathan, I can't see you at the moment, but if you want to say anything more about that, I would invite you to unmute yourself and expound.
Good morning, everybody. That goes to the number of questions from people about having third parties rent their space. You should approach your third parties who want to, restart again, basically saying, look, we need to have protocols in place. The real problem is you have hopefully a lease with the party that's utilizing your space, and depending on how your lease is written, it will determine the level of negotiation that occur. But in this time of pandemic, I would think that any party that wants to come and utilize your space is willing to sit down at the table with you and make it safe for both their people and your people. Your primary concern and focus, in my humble opinion, should be to protect the church. Because as you rightly pointed out, anybody can sue anybody. It doesn't have to do with really a legitimate cause of action, but it's the ability to engage the church in a lawsuit. And many times that alone, whether they prevail or not, will cost the church quite a bit of money and time in terms of legal fees and such. So preparation would be key. I would sit down with any third party that is renting your space for a gathering. One, that their plan or protocols adhere to the guidelines, current guidelines by the state. And two, that you mention that they must keep their protocols and guidelines contemporaneous with current state or governmental guidelines. Number two, I would seek specifically indemnity if anyone from their organization were to sue them and us, that organization through insurance or through outright assuming liability would cover the church for any such suits. So I don't know if that makes it any clearer, Mark.
Thank you. We'll see when questions come in. Thanks, John.
Okay. Yes.
So the next question actually is, do these protocols apply to churches that share space, or do they adhere to their own protocols if they're not part of the presbytery? And I'm going to suggest that Jonathan just spoke to that.
Yeah.
Is there a list of steps a church should take to prepare for reopening, or do we have to tap the links on the Presbytery website? I think what we are suggesting is a process to consider rather than specific steps to take. And what we're suggesting, what the guidelines provide, is a process to do this work, and through that process, you then identify the steps. The links will be very, very helpful. And again, if you've got the Word document with the links in it, you can click on the links there. You don't have to go to the Presbytery website. Thea, anything to add there?
No, that's exactly right. So, I mean, it does, the document links directly to the materials, and some of those do talk about things like removing hymnals and sanitizing surfaces and all of that. So there are many, many steps that are articulated in the materials. Yeah.
Can I say something a little bit about this?
Sure.
Good morning, everyone. So my background is in emergency management, and I would strongly encourage everyone to take a continuous operations plan training with NIDIS, or go to some of these webinars that are being offered, because planning, it was so much easier, believe me, to shut down the church than it will be to reopen the building. And we did not want to provide a cookie cutter approach. The guidelines that you will see on various websites and everything, they help you think about things you may have missed. But I really believe that all the churches need to consider what will happen if, for instance, we go back to a spike, and we have to shut down the buildings again. What will happen if New York City is hit by a Category 5 hurricane? These kinds of things have to be worked into your planning. And so if you're looking at something from Nebraska, they may be more concerned about tornadoes than hurricanes. That's why we can't do cookie cutter. I would just emphasize two parts. One is the planning, of course, but the other thing is communication and training. Before you take steps, you're going to need to train your people, both not only the staff, but your volunteers, in terms of what needs to be done, that's changed, that's different, that's a new normal. And then the second thing is that those things have to be communicated clearly not only to send it out widely through various modes, not only on the internet, but through phone calls. For people who do not have the internet, you're going to have to reach them somehow. And then also when people just show up at your church to attend services, they show up and they don't want to wear a mask, you know, how are you going to communicate to them what the policy will be, that they will not enter the space without agreeing to keep a mask on unless they're part of a, you know, a family unit? So all these things, you know, you need to work out in advance, and then you need to communicate clearly, and then you need to train your people on how to carry out your policies. Thank you.
Thanks, Brenda. Yeah.
So just jumping a question that kind of stays related, where are the materials you reference as documents that we have to access in order to follow the process? So again, I would say you've received the piece that this task force worked on, and that raises many of the questions that Brenda just raised. At the end of it are links to the documents that Thea included in the presentation, as well as many other documents, some of which Brenda, again, just referenced. If you didn't receive that particular piece, let us know, and when we need to get that to you. And
Yes, and sorry, Mark, go ahead.
Go ahead.
No, and then I was going to say, and then it will also be available on the website. But yeah, we're happy to send it to you. If you want to give us emails, we would love for people to have it.
And Bob, just to note that I have seen your piece will give you the final word. We are considering to offer to support protesters outside the building in our garden, water, snacks, outdoor portable potties. Does this put us and the Presbytery at risk? So
this is really a good example. So not only that outdoor service to the community, but also some indoor services, including serving as a cooling station over the summer and so on. Some of these are state sanctioned. So I would encourage you to do some research and, you know, even possibly be in touch with NIDIS, for example, to let them know that you're doing this, because that will be an inoculation against any kind of legal action that comes out of that if it is operating under some higher authority as well as your churches.
If a member is officially representing our church in our church building or outside our church building, could our church be liable if he or she gets COVID-19 or contaminates somebody with COVID-19?
So the only way that that is going to unfold is if you are convening your congregation and it is determined through tracing that the event of at your church was the event that infected that person. So if that person is a member of your church and is infected, having nothing to do with attending your church service, then that lessens any liability you would have.
And this might be a question to pose to your insurance company as well.
Yeah.
Should we wait until New York City opens up completely?
Well, again, we have tried to shy away from saying flat out. I mean, I think that the shared opinion of the task force is yes, that given when you think through all the considerations, for example, those who, regardless of what you choose to do, if you can only do 25% capacity, you are creating an insider-outsider environment. By de facto, that certainly exists with the 10-person limit. And so we find these considerations, for all intents and purposes, insurmountable in the current environment. But as we have said, it's such a quickly changing scenario that we hesitate to say, just don't do it. But I think if you spoke to any one of us individually, that would be our guidance. Anybody else on the task force want to chime in on that?
I think that when you start looking through the necessary steps to safely reopen and who would be affected by various aspects of your operations, you will see that it requires enormous resources to safely reopen, to physically reopen, and to provide an environment during operations that is going to protect everyone who shows up or, you know, does things in the church building. Some church communities may not be able to, you know, financially sustain that. And some church communities may not have the personnel to be able to carry that out. So that's why it's very difficult for us to say to you, absolutely can't, nobody can reopen, but we urge extreme caution.
So Brenda, while you're on, do you want, you put a comment in about cooling stations? You want to, not everybody's able to read the chat.
Oh, sorry. So I just want to say that the city and NIDAS, which we have talked about before, they both have sent out calls to the faith communities to offer buildings as cooling stations. This can be, you know, a great way to serve the community. However, again, we would caution that in order to safely provide your resources as a cooling station, a lot of work will need to be done. And, you know, maybe you can get sufficient guidance from the city and NIDAS on what you need to do in order to be that resource. So I'm just saying that if you want to be that resource, you should definitely check with New York City and NIDAS.
And I believe there's also some grant support that NIDAS may or may not be doing through their financial piece, but I know the state is providing grants for that. So, yeah.
All right, thanks.
Yep.
Is the threat for holding outside services less than for holding inside worship?
Yes. Any outdoor activity, by virtue of it being outside in the open air, is somewhat less of an issue, so long as the distancing guidelines, the wearing of masks, not hugging, not shaking hands, touching, sharing food, all the other pieces still apply. But the reason for that is, you know, it's sort of like the old adage about the salt in your teacup and a salt in the lake. It's just a matter of the greater ability for the aerosols to be carried off on the breeze than if you're in a contained space.
And Thea, I would add once again to not forget how important it is to keep the consideration about singing.
Yes, yes.
Because even outdoors, singing, the aerosols actually go at least 18 feet at the most.
Right.
So we have to really be careful inside and outside in terms of singing.
Thank you, Derek. That's so true. Singing is just don't. That's the one.
Sorry.
I mean, and you know how hard that is for me, Derek, and for you. I know it's like, oh, this is the worst. But anyway, yeah, just don't sing in your home, sing in the shower, everywhere, but not with your church family.
So friends, our time is upon us. There is one more question in the chat that actually I was going to speak to. And that question is, can we consult any of you on the task force if we have specific questions as we go forward? And the answer is absolutely yes. My assumption is not all questions can be asked in 45 minutes. My assumption is some of us need to take what we have heard and process it and come back the questions will come up later. I'm going to invite folks on the task force, I kind of call you out by name, and I'm going to call you in a specific order. With Bob, you'll be last, so you get to have the final word. To see if anybody wants to make any comments, and this way will help identify those of us who are on. So I'm Mark Koenig, and I am a task force member. And Derek, I would invite you to just say hey and let people know that you're on the task force.
Hey, I'm on the task force.
Hey.
Not a morning person. What's that?
Just,
Oh, okay. I'm sorry. I was laughing at Derek,
Brenda is
so
a
I had
task
to.
force member, Brenda Berkman.
Yeah. So as I said, I'm a retired New York City fire captain and have degrees in emergency management. And I'm an elder at Fifth Avenue Presbyterian and chair of the Justice Ministries Committee for the Presbytery.
Thea?
Well, everybody's heard enough from me for one 45-minute session, but yeah, I'm on the task force and happy to be in touch with anybody.
So there's a question that I'm responding to in the chat right now about task force members share their contact information. I'm putting my email in so people will at least have that. If other folks want to type your email into the chat, that would be helpful. As was mentioned at the beginning, this is the first of event we're doing. There will be others, and so as I turn to Samson Cho, who is another task force member, and information about the next event.
You all see the screen in front of you?
Yes.
Yes.
Okay. Hi, good morning. This is Samson Cho. Next Tuesday, we have invited an outside speaker. His name is Reverend Dr. Stephen Cole. He is the pastor of New York Chinese Alliance Church in Manhattan, but he's also a medical doctor. I've been to a couple of workshops that he has given, talking about regathering in person in your church, safely, effectively, and biblically. So he has agreed to give the same presentation for us, the New York City Presbytery, at 2 o'clock next Tuesday, June 16. Tuesday, June 16 of next week. It'll be an hour workshop, kind of like what we did. It will be done similarly like we did with Zoom. And if you're interested, please send that email, respond to Mark using the email address below, Mark Koenig at presbynyc.org. And you'll hear more. We'll send this out also across the email list for anybody to hear more about, what do we have to do in terms of preparing our churches when and if we do reconvene into our in-house worship. So I hope you can all be there. That's next Tuesday, June 16 at 2 p.m.
Thank you, Samson. And if you could take the slide down.
Yep, I will.
So that we could put Bob up. And Bob, I call on you to close.
Yes. Thank you. I want to acknowledge to this presbytery that we are a multilingual presbytery. We have worship in 11 languages, and all the documents that we have given to you are in English. And if that becomes a necessity for us to, as a team, to come alongside at a special event for your folks to be able to speak and someone translate, we want to make sure that the messages and the teaching that has been represented on these slides is able to be communicated effectively. Not all of us are as able to speak in 11 different languages at once. So I want to acknowledge that up front. We want to do everything we can to help get this message out. Secondly, I want to also commend all of you who have found new ways to continue to reach people when your church building is closed. And some of the guidelines that we've listed, even with people in vulnerable populations, they were able to worship with you when they may not have been able even to walk to your church, even to come to your church. We had people on a Zoom meeting in the hospital with the Presbytery meeting. So I don't want you to too quickly shift from what you have learned about people being able to participate in your church by using alternate methods that maybe were not as familiar to you prior to this pandemic coming and closing our buildings. Continue to look at those and how you can include people not only who are in your church, but people who are from afar in some cases, tuning in to what you're doing, whether it's a Bible study, a prayer meeting, or worship itself. And lastly, I just want to say thank you to John Chu with the President of Board of Trustees, because the trustees also are working on some other concerns that maybe weren't mentioned in this call that pertain to things that you've addressed, like these tenants help pay for rent in our building and we're suffering financially. And we don't know what to do about the loss of rent if they don't come back in. Some of those financial questions and some of those other property questions, our boiler is out. What do we do? We have fines that happened. I want you to know the trustees have another group of people working with those kinds of questions, and you can consult them. You should be in touch with your insurance company to see, one, does your insurance company even include viral pandemics in the policy itself? Because some of the questions that have come up keep circling back to asking your insurance company the very questions that have come up. So please do check with them. And lastly, I want to acknowledge that if you're confused, if your people are confused, if it's been difficult, know the political messages have been all over the map. And as was said earlier, different parts of the country have been less affected, but different parts of the country that opened up, believing that they're not affected by coronavirus, suddenly have seen spikes with reopening. And we were in New York City or in New York State listed as phase 4 for congregations to reopen. This week we began phase 1, and part of the reason we were down in phase 4 was to watch what is the impact of businesses reopening in part or in larger numbers, certain businesses reopening over phases 2 and 3, so that if this is going to spike, that we are seeing what we have to do before churches reopen, and suddenly they know the safest way to reopen. But the governor has kind of superseded his own messaging and said, sure, 10 people can get back in together following protocols we've outlined, and people are pushing to say, when do we get to 25% of our constituent group so that they can move? And the messaging has not been consistent, and we are trying to love our neighbor and to love you enough to say that we want to do what we can to say we want to be able to continue to worship God in whatever way we can and to love our neighbor in the most responsible ways. So I thank you for taking the time to be with us here, because we do care for you and we don't want to create moral hazards in our churches, moral hazards for the presbytery, or moral hazards for the city by what we do. But I do think that there are ways to address these things if, as Brenda was saying, plan, 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 read, plan, 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 and take into consideration that reopening is indeed harder than just shutting down. And the last thing I want to say is, one of the things that you may need to do now is make sure that you have documents that are really important to you, like your insurance policy, that are accessible to you outside of the church building. This is a key component of disaster planning, that there be alternate sites, alternate ways, like scanned documents that other people can get access to when you cannot get into your building, because I know many, many important documents reside in your building. So please have that as a consideration of backup plans, and communicate well to your constituents, to your congregants, how we can move forward in the best way that God's giving us guidance. We don't want to see a spike again in flu season if we can avoid that. So we're moving carefully into all these guidelines. And I'd like to thank all of you for being with us today. I just say the Lord be with you in your discernment and your work with your church so that you do the best you can to follow the work of this discernment team and God's guidance to be with you in opening or not opening as you go forward. Thank you.
Let people say amen. Thank you all. So Bob, I will send the invitation to our afternoon team meeting. I'll send that now. I hadn't sent it before because I didn't want to confuse people like myself. Take care all.
Thank you all.